everybody. So hi to everybody who's already been following me on previous accounts, and hello to anybody who's never followed me before. This will be an update for some of you and new information for those who are new to me. Hey everybody, my name is Beth. I am 34 years old from Ontario, Canada. I am on disability for multiple disabilities, multiple medical issues. I live with my best friend. He is my greatest friend in the whole wide world. Love him to pieces. Couldn't ask for a better friend. I'm going to tag him in the comments below because I want everybody to go follow him. Try to get his account up. So a little bit about myself. I have chronic illnesses. For that reason, I'm unable to work at this time. I do sell Sensi. And you can always ask me about my Sensi. It'll be linked in my bio. I've got to get that set up. So that's what I do to make a little extra money. You might be asking, what medical conditions do you have that prevent you from working because you look healthy? Good questions. So, to start with, I have a feeding tube. That doesn't necessarily prevent me from working. It's a challenge to get a job that I'd be able to use my tube if I needed to be on my tube. But it's not the preventative. So I have what they call a GJ tube, and I have limited oral intake. Now, what limited oral intake to me looks like is I can go days, months with being able to eat. And I can also go days and months without being able to eat. Because of other conditions I have, it causes me to vomit. And therefore, I can't orally intake food or drink. And so I have this tube here. So this is the balloon port. There's a balloon on the inside of my stomach between my stomach and the outside of my stomach. So like the abdomen wall to hold the tube in place. This tube goes into my jejunum, or the small bowels. That's where I would feed into. And this is my G tube, which is what I drain or put medications into. I have a feed pump. I have the infinity pump. So this here is my pump that I would set up to be able to run my feeds. And it runs as fast or as slow as I need it to on that day. These are the bags I use. I do need more. I'm running low. This is 1200 ml bags. I have no more of these ones left, and this is my preference. I do have 500 ml bags, but I really do prefer the 1200. I also link my Amazon wish list in the bio. That wish list is got medical needs on it. So, moving along. The reason why I have a hard time with eating sometimes is it was thought to have gastroparesis, or the starting stages of gastroparesis. However, all my tests are coming back saying that's not so. That at that time, I'm not in a flare or anything like that, and so my stomach's emptying normal. So now what they're calling it is functional dyspepsia. And basically what that means is my body's mimicking gastroparesis, which in layman's terms means the stomach's paralyzed. My stomach isn't paralyzed, my stomach isn't paralyzing, but it's having a hard time with digesting food for whatever reason. And so they call it functional dyspepsia. I also have something called cyclic vomiting syndrome, or CVS. And that's it. The name basically describes itself. I have cycles of vomiting that can happen for no reason. I can just be sitting here talking, I could swallow my spit and start choking. Or I could just have a choking fit and then it starts me vomiting and then it continues. I have been recently diagnosed with esophageal dysphagia. I'm hoping I'm saying it right. Esophageal motility delay, so I have a delay in swallowing. That also causes me to choke. And on liquid, on food, solids, doesn't matter. And so they're going to try to get me into speech therapy, and that apparently can help with that. One thing that I haven't told anybody about before, because I completely forgot, because I haven't had a flare in a while, but I have something called Costochondritis. I don't even know if I can ever say that right. That's inflammation basically in the sternum area, and it causes a lot of pain, can mimic an anxiety attack, and so it's inflammation right in this area, and it causes a lot of pain. I will absolutely list all of these in the bio, or not my bio, sorry, but in the comments as well, if you're interested in learning more about it. I also have bipolar type 2, borderline personality disorder, anxiety and PTSD, depression, and ADHD. Yeah, I got the lucky pick there with all those mental illnesses. I have I'm type 2 diabetic, insulin dependent, so oral medications don't work for me. I am on insulin, working towards getting an insulin pump. I have sleep apnea. I have asthma. You will see me vaping if I'm on live. It doesn't trigger my asthma. My asthma is pretty well controlled. I have acid reflux and bile reflux. So acid reflux comes from the stomach and up the esophagus. Bile reflux comes from the intestinal tract. I have polycystic ovarian syndrome. So women, y'all know about that. Some of you men might know about it too. If you don't know about it, go for it and look it up. And I also have mobility problems. I say problems because it's not that I am disabled to the point of I can't walk or I can't get around, but I have a hard time with far distances or standing for long periods of time. So yeah, in a nutshell, that's me. I will now go back and try to explain things a little better. Actually, I'm going to change it up a bit. I was going to explain it all in this video, but I'm going to actually go and make separate videos for each of my conditions that are not very well known. And that way there, if there's a specific one you want to know about, you can just go and find that video. I'll title them all so that you can find them. Thank you for watching. As always, if you have any questions, feel free to ask. As long as you are respectful and kind to me, I will be respectful and kind back. I don't put up with trolls and bullies though. That just gets me in trouble. So if you're going to troll or bully me, you will find yourself blocked. I already have a lovely group of people on here that I'm very good friends with, and they are my mods in all of my lives, and they will take care of you if you are rude or bully me. Otherwise, again, mwah, love you guys. Thank you. Hello to all my new followers. I hope I have been informative in this video, and you maybe learned something. Again, feel free to ask questions. I'm an open book. Bye.